Having diabetes can be a daily struggle. Balancing act is about controlling your blood sugar levels and keeping an eye on your nutrition. Keeping fit is important to many people. And using pharmaceuticals. The purpose of diabetes drugs is to regulate blood sugar levels, but like everyone, medication adverse effects are possible. These negative effects could potentially include a higher risk of cardiac disease, failure. This is an alarming thought, but it's important to understand that not all diabetes medications carry this risk, and even among those that do, the risk does not apply. Before we go any further, please hit the like and subscribe buttons. If you appreciate all the information and research that goes into making a video like this. Consequently, let's explore 5 diabetes medications that have been linked to a higher risk of heart failure. Putting the most shocking one last, we'll start with the DPP-4 inhibitor Alleglyptin, which lowers blood sugar levels. Although some studies have linked Alleglyptin to heart failure, especially in patients with a history of heart disease, it is not entirely clear why this occurs, but it is thought to be related to the drug's effect on certain hormones that can cause fluid retention. Alleglyptin is quite effective at managing diabetes and is frequently used in combination with other medications. Heart failure can result from fluid retention, which puts additional strain on the heart. It's sometimes necessary to emphasize that although the risk is typically thought to be low and many individuals take Alleglyptin without any concerns, it is something to be aware of, especially if you already have cardiac problems. Exinited by etabidurin, a GLP-1 receptor antagonist, is the following in our list. Although the link between this type of medication and heart failure is not as well established as it is with Alleglyptin exenatide, some research has raised concerns, especially in patients with pre-existing heart disease. Although the mechanism underlying this link is not fully understood, it has led to recommendations for careful consideration when prescribing this medication. Moving on, we reach Saxoglyptin Angliesa, where the risk is believed to be low for persons with pre-existing cardiac diseases. Many people use exenatide without experiencing any heart-related issues. A different DPP-4 inhibitor similar to Alleglyptin, however, some studies have suggested a link between Saxoglyptin and heart failure, particularly in those with a history of heart disease. The precise reasons for this association are not fully understood, but they have led to increased caution in prescribing this medication to those at higher risk of heart problems. Saxoglyptin helps control blood sugar by affecting the body's insulin production and sugar processing. Once more, it's crucial to keep in mind that while the danger is generally regarded as low for most individuals, it is something to be mindful of. Although pioglitazone is well known for its ability to increase insulin sensitivity, it also has several drawbacks. The medication has been linked to fluid retention and edema, both of which can put stress on the heart and result in heart failure. Due to this side effect, it is advised that persons who already have heart failure avoid pioglitazone and that those who are taking it be thoroughly watched for any heart-related issues. It's a serious risk, but it's important to remember that many individuals use pioglitazone without suffering these problems. If you're thinking about taking this medicine, talk in depth with your doctor, especially if you have a history of heart disease. Finally, we come to the medicine that surprised us the most. Similar to pioglitazone, Rosaglitazone is another TZD that was once frequently prescribed for the treatment of diabetes. However, several studies have connected Rosaglitazone with an increased risk of heart failure. And in some cases, the risk was found to be so high that the drug's use was restricted. Rosaglitazone has a stronger link to heart failure than the other medicines on this list, necessitating close monitoring and cautious thought while giving this prescription. Rosaglitazone's association with heart failure served as a wake-up call for the medical profession and the pharmaceutical business, prompting closer examination of diabetic drugs and any potential heart-related adverse effects. It serves as a reminder that drugs are complicated, and even ones that are helpful in one manner might have unanticipated adverse effects. Although there are a variety of problems that may be of concern owing to the use of these medications, some of the possible dangers connected with various diabetic medications and their link to conditions other than heart failure might vary. These issues include bone fractures. This risk might result from modifications to bone structure and density. Urethral cancer. Concerns have been raised regarding a possible link between pioglitazone and a higher risk of bladder cancer. Regulatory agencies have looked at this possible concern, and warnings about it are normally included on the labels of drugs that contain pioglitazone. Dipeptidyl peptidase for DP4, one of the diabetic treatments, has been linked in certain cases to pancreatitis, an inflammation of the pancreas. While the danger for inhibitors like Saxoglyptin and Alleglyptin seems to be minimal, liver function problems should still be taken into consideration. Some diabetic drugs, notably thiazolidinians, have been linked to changes in liver function. When using these drugs for fluid retention and edema, regular monitoring of liver function is frequently advised. Some drugs, such as thiazolidinians, can aggravate pre-existing diseases, including congestive heart failure or renal disease, by causing fluid retention in the form of edema, swelling. Digestive disorders. In conclusion, some people who use specific diabetic drugs may develop gastrointestinal side effects such as nausea, vomiting, diarrhea, or upset stomach. Despite the considerable worry about the risk of heart failure linked with these 5 medications, not everyone should avoid taking them. The key is tailored treatment and vigilant monitoring. Knowing your own personal heart disease risk factors, working closely with your doctors, and staying informed about the medications you're taking can help you manage both your diabetes and your heart health. It's also important to keep in mind that the landscape of diabetes treatment is constantly changing as new drugs and management techniques are created. Future developments may result in even safer and more effective ways to manage diabetes without raising heart risks. As with all medical concerns, information is power. Research into the relationships between diabetes and heart health is continuing. It's possible to manage your diabetes effectively while also taking care of your heart by staying informed and collaborating closely with your healthcare team. It's a journey, but one that you can navigate with confidence if you have the right support and information.